All right, we're going to go ahead and get started tonight. It's great to see you all here. Thank you all for coming tonight. We're very happy to be able to bring this program to you about the growing health risks of climate change. And for those of you who don't know me, I'm Linda Hamilton. I'm the Executive Director of ANCA, Accelerate Neighborhood Climate Action. For those of you who may be here for the first time and don't know anything about ANCA, very briefly, our mission is to work collaboratively to build climate-resilient communities, neighborhood by neighborhood. This next image up here on the screen kind of tells you a lot about what we're about. This is our vision for a climate-resilient community. And this vision is something that we hope everybody can work toward, both on a neighborhood level and community-wide. So it's based on three major goals. One is to reduce carbon emissions. Another is to increase preparedness for more severe climate impacts. And the third is to ensure environmental justice in everything that we do. So the green boxes there, we call those our vision elements. And each one represents something that we would like to see in our community in the future, hopefully the not too distant future. So you can see there are things like the local sustainable food system and sustained water conservation and so forth. So in all of our programs, this is kind of the framework, our goals and our vision. And then in our educational programs here at the community center, what we do is each time we focus on a different vision element or one of the goals. Tonight, you know which one we're focusing on. Localized, accessible healthcare. I must say this one is one we are very unsure how to word this. We'll get more insight after our panel tonight on what this really should be called, but what is it that we really need at the local level when our world is going to change so dramatically in the future. So, and then for each of our vision elements, we have specific goals that could be actually implemented in a neighborhood. So you can see some of these here for what we call local accessible health care, like a care system in place for vulnerable neighborhoods when disaster strikes. Increased understanding of the health threats and how to avoid. Everybody in your neighborhood should know about that. And a neighborhood health assessment, neighborhood promotion program, and education and resources for climate anxiety. Things like that at the neighborhood level, and also community-wide. So I just want to say that I've been following health risks attributed to climate change for several years now. Actually, it's only recently that stories started to appear in the newspapers and so forth. And even before that, I knew deeply that everything is interconnected and interrelated. But seeing what is happening to our health and to the health of so many other species on the planet has really deepened that understanding for me. And it's very clear to me now that the less healthy our planet becomes, the less healthy we all become, right? So our community education working group thought this was a very important topic for us to bring to you. And my hope is, as it is for every program that ANCA presents, is rather than becoming depressed about a topic like this, you will let it motivate you and energize you to take action to heal, to help heal our planet. And we who are alive today, we have this opportunity and we have this responsibility. This is a time, this decade, when we can still make a difference. So tonight, we are going to learn about some of the specific health risks that are emerging worldwide, including in the US and in the Inland Empire, the undeniable interconnection between our environment and our health, how health inequities are being exacerbated, about how our health system is responding to this new reality and the challenges it faces. And finally, we're going to hear about what are the implications for us and for our community and what action we can take. So our panel tonight, we decided not to take a lot of time to read bios. So rather, what we're going to do is pop up on the screen a little bit about each of our awesome speakers here. And they'll be telling a little bit about themselves as well. So I'm very happy tonight to introduce our moderator, Dr. Juan Carlos Belier, whom I met at Esri, and Esri Forum that presented in February. And he is, to say a word about him, he's the Assistant Vice President and Director for Community Partnerships at Loma Linda University Health. And he also works on community-based models for healthcare and much, much, much more. We could not possibly tell you all the things that our panelists are involved in healthcare. But we're so honored to have them here tonight. And so with that, I'm going to turn this over to Juan by handing him this microphone. There you go.
Good evening, everyone. So I do have to clarify that I am not a physician. These guys are physicians and future physicians, so if you have any aches and pains, don't come to me after the meeting. I'm a professor in public health and a PhD in higher ed, but very passionate about this topic. We're going to keep this conversational tonight. And when I look at the room, I see the hope for our community. So I'm excited to see people here that are interested and take the time out to really learn about this topic. So what we'd like to do with our panelists is Dr. Sang, Dr. Sanchez, and future Dr. Egan, is begin with, if you can just share with this group how you got interested in this issue of climate change. What drew you to this topic?
I guess I'll start. Can you hear me okay?
Yes.
Yeah? Okay, wonderful. So first of all, thank you so much for having us here tonight to talk about this really important topic. I think Linda outlined it quite well. You know, as a family physician, also as a public health practitioner, I have my master's in public health. And so, you know, when we think about individual patient care, you know, we think about what impacts our overall health outcomes isn't necessarily just the medical, but all the things that surround you, right, your environment. And so on the individual care basis, what we're seeing is that we're seeing a lot more heat-related, climate-related individual illnesses, increased respiratory issues, increased, you know, fatigue, heat-related type illnesses. So from the individual patient level, we're seeing more of that, and how do we think more upstream? How do we fix that so that we're not getting all this downstream consequences of them showing up in our offices? Thinking about it from a population level, we also want to think about, well, our communities. How do we keep our communities healthy? And that's the public health approach, which I think, you know, Dr. Belliard can speak more to. But when we think about keeping each other healthy at a community level, that directly impacts both the individual, at the community, and everything within that community. And climate health and climate change will directly impact us at all levels, especially at that population health level. So, you know, I'm going to pause there, and that's really what brought me to this topic, because I'm trying to still think upstream, even though, you know, I do direct patient care. How do we stem the tide of what we think is coming by going further upstream?
Wonderful, and nothing gets me more excited to hear physicians talk about upstream and prevention, and that's why I think a lot of physicians need to get their MPH also, you know, it shows. So Dr. Sanchez, what drew you to this topic?
Well, again, thank you, Linda, and thank you, ANCA, for inviting us here. I'm really excited to be here with you tonight and really talk a little bit about the impacts of climate change and climate health. What got me involved is actually slightly different. For me, it was actually I've been more involved in policy. So I've been working more at the local and the state level on policy issues. And about 6 years ago, a number of young physicians at the California Medical Association approached me with the hopes of helping them push policy on climate change at the state level with the California Medical Association, because they had been trying to develop policy through resolutions and nothing really was getting through. And so that was what got me involved. And they simply asked me, can you help us through the process to figure out how we can make policy at the state level for the California Medical Association. And through that, I've actually learned quite a bit on climate change. And one of the things that really jumped out to me as a clinician, as a family practice physician here, is that I started looking at what was happening in our community here locally, as well as our community in California. And one of the most interesting things was the increase of cardiovascular events. We had been doing a fantastic job of treating heart attacks, treating strokes because of medications and a lot of the treatments that we have available. But in the last few years, we've seen that increase of cardiovascular events. And as we looked more into it, we started seeing that that impact was primarily in areas where there was a lot of pollution. And communities where the freeways were very close to those communities, and communities like ours here in the Inland Empire with warehouses. And then I started asking, well, why is that? And as we're looking more into it, we're beginning to realize that that's one thing that sometimes we overlook. And all of you, most of you are over 50 here. Some of us are a little younger, not me. But most of you are going to be impacted by that, whether you like it or not. And that's what is driving me now more to continue to develop policy at the local level, at the state level, and now at the national level as well.
And very well put. And while we're going on to Brianna, I think what I hear a lot of healthcare providers saying is that they get tired of treating the patient and then sending them back to the same environment that caused the issue in the first place, right? And that's what Dr. Singh was talking about, upstream, not just treating the symptom and the illness there, but the root cause of that illness. Brianna, what got you interested in this? And I know you're quite the activist and very. Brianna's studying for boards right now, so just the fact that she's here is amazing. So I want to thank her for that.
Well, thank you. And just to echo everyone else, thank you for inviting us and having this conversation tonight. I'll share, I think that my kind of climate awakening was in college. I studied human biology and global health down in San Diego, at UC San Diego. And I remember my sophomore year, I took a elective on toxicology and pollution. And this was really eye-opening for me. The professor took a very interdisciplinary approach to teaching us about toxicology and introduced a lot of foundational climate science concepts to us, like the Keeling curve, which came out of Scripps Institute of Oceanography. And so just to kind of be there and learn from scientists was really eye-opening, as well as I think I got really interested. It was kind of the peak time of the California drought that we recently have gotten out of, but I got really interested in learning about how can individuals reduce your water footprint, and it goes way beyond the water that you use in your daily life, but also touches on your diet and how your diet plays into water use as well. And so I remember reading into that, getting really interested in kind of all those connections. And then I was lucky enough to study abroad my senior year in Costa Rica in a program that was a tropical biology and diversity program. And I think that was a really special experience, and also a chance to see how different communities and the country of Costa Rica is a climate leader. And it's something that's just embedded within their national policies, conservation, and even just the conversations that you'll have with people in town, and banners on the side of walls that say, how will we reduce our carbon footprint in Spanish. So these are conversations that are out in the open, that are just part of everyday life, because the effects of climate change can be experienced more closely in places like this where you have less rainfall each year. And so, yeah, I think just experiencing those and asking questions and kind of bridging that into health work. I knew I was interested in public health and medicine, but I also wanted to make sure I could continue climate work as well. And the great thing is that there are lots of organizations, both nationally and statewide and locally as well, for climate health, to bring healthcare practitioners together in learning and engaging on this, and being forces for change in their community.
Wonderful. And just like you were saying, we don't separate climate health from physical health. It's really important to remember that. I'm glad you mentioned Costa Rica because I took a class of public health students to Peru for 8 years. And over those 8 years, you could see the difference in the climate. And indigenous communities are very in tune with nature and the climate. And they would tell us this has never happened before. What we're seeing is something we've never, the migration of entire communities because of climate change. It was more magnified in communities that are closer to nature, I think. So I'm glad you mentioned that. Let's go to our question about the health risks of climate change. And we don't have to go in order here, but we'll keep it conversational. And if somebody says something that you want to add to, just be brief, but feel free to chime in. I know in my family we talk over each other all the time, so I hope that's not a problem here. But let's discuss a little bit about what you see are some increased health risks with climate change that are associated with climate change.
Well, as a primary care physician here, I practice here with Kaiser Permanente here at the Redlands Medical Office. And I have mostly a geriatric population. So, like I was talking earlier, for me, the biggest impact has been the increase in the cardiovascular events that we're seeing. And as I'm talking to our patients more about their risk, I'm finding out that a lot of them are living in places where there's high pollution. They're living closer to the freeways, they're living closer to the warehouses here in the Inland Empire. I do have patients that live in different areas who are not having those issues as much, especially those individuals who live up in the mountain in Big Bear and those communities. So that keeps coming back to me. And then obviously the issues with allergies. It seems like allergies used to be something that we dealt with on more seasonal times. We're seeing them year-round now, okay? So that's becoming an issue. Younger folks getting diagnosed with asthma much sooner than before, and now having to use multiple medications to treat their asthma. It used to be relatively straightforward how we treated asthma, and now it's much more complicated because we're having to treat people for asthma with multiple medications, not just one. So those are the real impacts that I'm seeing in my clinic. And you may not think that those are because of climate change, but this extreme weather patterns that we're seeing. Last year we had a ton of snow up in the mountains. We had people barricaded there for weeks on end because they couldn't get out. And then the year before we had a drought. And it was so hot over there, temperatures in the 70s and the 80s. And then people trying to come down the mountain to get their medical care. That was very challenging for them. Okay, so those are things that we are beginning to see more and more and more. And it's not just impacting us on a local, on a sort of a big picture, and we're not seeing it, but we have to be able to help people sort of connect the dots. The reason that this is happening is because of climate change. And so, and you have to be aware of it, rather than try to ignore it and say, it doesn't affect me. So that's what I try to do as I talk to each and every one of my patients, especially those that I find that they are at risk of developing diseases because of the climate change patterns that we're seeing in our communities.
Yeah, thank you. So I'm going to touch a little bit about our changing climate and its impact on the different type of bugs that we're now noticing, right? And so I am a magnet for mosquitoes. They love me. If they're in a room, they will find me. And so this is particularly near and dear to my heart.
I'll have to take you camping with us.
Yeah, well, actually, my husband says that. He says, if you're with me, I'm good. I don't get sick. They all come to me. So these are things that, especially as we think about mosquitoes, right? Mosquitoes carry all sorts of what we call vector-borne diseases. And we're seeing things in the United States that we should not be seeing because of the different shifting in the climate itself. So when we think about vector-borne infections, I actually pulled up some statistics because I was very interested in just better sharing with you. So, you know, we've seen essentially, we're hearing that without any kind of climate action, valley fever cases are projected to increase by 220% by the end of the century. Lyme disease incidence has doubled over the past 2 decades. Lyme disease, right? And so it's no longer, you know, just if you're out in the Rockies or somewhere hiking, it's coming into our spaces because we're in their spaces. And then if we think about West Nile virus, you know, I first heard about West Nile when I was at the CDC. We were just learning about that particular virus. And what we're seeing now is that since 1999, which we are seeing essentially 56,575 cases more, and 2,776 people have died from that. And these are things that are, again, we see West Nile signs. I don't know if we see them up and around. You know, we track West Nile in our areas, and we try to do spraying. But for somebody who is like the biggest mosquito magnet, this is a fear of mine. Right? I don't want to contract something because of the way we are impacting our climate and the way the climate is reacting to how we're impacting it. So as we think about the vector pieces and how it impacts our health, you know, I'm talking about mosquitoes, but you can apply this across. We're seeing things like, you know, avian flu that's now in cows, right? There's a lot of this trans migration of viruses from different animals and species that we haven't seen before, and it can be very devastating to us as our fragile ecosystem is trying to survive this. So I'll stop there and hand it over to Brianna too.
And those are great points. Even dengue, you know, dengue is usually something you thought of in the tropics. Now we have it in the U.S. as well. And I mean, just think about our patterns of like backyard use. I know last summer we hardly spent any time in our backyard because we were just getting eaten alive by mosquitoes, right? The ankle biters. So even the way it changes our behavior a lot of times. Brianna?
Yeah, I think this dovetails really nicely with the topic of One Health. So if you've heard of that, it's a kind of an encompassing global concept that our health is interconnected with the health of plants, animals, the environment. And we can see that interplay in some of those examples that we've mentioned. And to touch on that a little more, something that's been affecting us locally has been the citrus greening disease and a few other pests on citrus plants. And I know there's been quarantines, and the California Department of Agriculture is going around and managing that and observing and seeing how it's spreading and how they could contain it. In my neighborhood, they've been leaving notices on our door that they'll be spraying, I think it's organic pesticide, and they've done that a few times. So yeah, so I think this is something that is touching us now, and we can think about how it could have that ripple effect into our food system, whether it's citrus, foods, and the local economy, or larger things like crop, more pressure on crops that will affect our food supply. And so, yeah, I think it's a helpful concept to think about One Health. Something else I wanted to add to the discussion on air pollution. So every year the American Lung Association releases their report, and it's a scorecard of all the counties in the country and how they rank in terms of the levels of overall particle pollution, PM 2.5, and ozone. And it's a pretty useful report that goes into detail on a regional level. But something that always stands out is if you search San Bernardino County and Riverside County, these counties are always at the top of all those lists, and this is nationwide. And close to us are the Central Valley as well. And so, yeah, so I think that air pollution is a really pressing issue within our counties. And there's so many reasons for that and causes for it, as Dr. Sanchez alluded to. Transportation is a huge piece. And we see how the impact of warehouses and logistics and diesel trucks, just the square footage of that multiplying within the past few decades alone, and how that impacts sensitive receptors and homes and schools that are near warehouses. So these are conversations that I think we need to have on a local level, on a policy level. I know there is some movement to transition diesel trucks to electric trucks, but solutions go far beyond that. If I could share a few of them, because this is kind of one of the policy advocacy areas that I work on in my spare time, is like transportation solutions, which is the idea that in the state of California, transportation-related emissions are the largest portion of our greenhouse gas emissions by sector. And so that is from cars, trucks, freight trains that have diesel fuel. And we kind of thinking about how can we shift away from that. I think personally, and this is something that I try to work on, is mode shift. So this ties into land use and making it easier for people to get around by bike, by foot, take public transit, take the train, shift freight rail onto electrified freight rail. And so, yeah, this is something that I do spend a lot of time thinking about and working on in various capacities. So yeah, so I just wanted to share that as an element to think about tying into the air pollution.
Great. No, and thank you for already sharing some solutions as well, because I think a lot of times we get mired in the problems, and it's like we walk away more depressed than we were when we got here.
If I may,
Yes,
can I make a quick point? How many of you know John Hewson? Okay, so you guys know who he is. For the last 30 years, he's been the #1, and for those of you who don't know him, he's an economist at UCR, University of California, Riverside, who has been championing the logistics industry for the last 30 years to the Inland Empire as an economic development. He is the #1 responsible for that. And every year, he puts his economic forum, and he brings all these folks over and talks about how beneficial the logistics industry has been to the Inland Empire. Not once has he had anybody talk about the climate impact of the logistics community to this forum, or the climate health changes that have occurred. The good news is that he's no longer holding the forum as much as he used to. The second good news is that now those of us at the policy level that are interested in climate change, especially here in the Inland Empire, are talking to our local leaders, and they're hearing that the logistics impact and the economic impact is one thing, but we also have to take a look at the human impact of what we're doing. And they're finally listening. So hopefully that'll be one of the solutions that we can walk away from and continue to have these conversations.
And this whole, it's a false dichotomy to say it's business versus public health. We can have both. We can have the cake and eat it too. There's no reason why there has to be this tension. We heard a lot of that during the pandemic also. It's either business or public health. Now, we can do well by doing good. And I think that's what we're hearing from our panelists today, so I appreciate it. And the concept of One Health, I think is something we need to take home with us tonight. Because what happens to us here in North Redlands impacts South Redlands. What happens in San Bernardino impacts Loma Linda. So it's not just about my little community or my immediate family. It's really about our larger community. And the canaries in the coal mine are usually our most underserved members of the community. Dr. Singh.
I just wanted to add on to a comment you made about the fact that it doesn't have to be mutually exclusive. Healthy, thriving communities bring in business. If you have a healthy, thriving community, people want to move there. Your property values go up. The schools are seeing add-on dollars and grants. You have businesses coming in. You have small business, large business. So I think, we want to make sure that, I think one of the biggest pieces is how do we live in balance of all of that. And that's something that I think we sometimes struggle with. So, I think part of it is the logistics. I live in Riverside County, so I see miles and miles of logistics, usually in marginalized communities, right? And so, thinking about health equity, that is a huge component, but wanting to make sure that we aren't trying to vilify any one side. It's really how do we coexist and lift all communities, because if we can lift all communities and the communities are healthier, we'll actually see everyone thriving.
Excellent. Let's move to question number 2. Now we're going to shift to healthcare. And you're all familiar with healthcare. What are some of the impacts that either healthcare has on climate change, but also that climate change has on the delivery of healthcare?
Well, I'll go ahead and start and just give you a little brief introduction of what sort of our healthcare system does to climate change. So we sort of have broken down into 3 scopes what kind of pollution the healthcare system sort of is responsible for. So the first one is scope 1, which is primarily everything we do in the hospital, how we take care of everybody who comes in, who goes out. So that's sort of the primary thing. And we're responsible for about 8% of that comes from just healthcare alone, okay? So our hospitals, our clinics, everything to take care of that is about 8%. The good news is that here in California, the majority of the healthcare systems have decided to become carbon neutral at one point or another. Most of them by 2025. And I don't want to take a bow, but my system, Kaiser Permanente, we've been able to achieve that by 2020. So all of our clinics, all of our hospitals are carbon neutral as of 2020. Now, again, it's only 8% of all the pollution that the healthcare system produces the whole time. The other ones is what we call scope 2, which is all the electricity that we're bringing in, everything that comes in to be able to run our hospitals. That makes up about 20%. And then the rest of it is what is called scope 3, which is everything else indirect that we do. Any travel I do, and my car that I bring out, who I do business with, who brings in my materials and so on. That's the other percent there, which happens to be about 70%. So that's what we're working on. That's what we want to try to address. So most of our healthcare systems here in California have recognized that they need to act on all 3 scopes. Scope 1, Scope 2, and Scope 3. And we're doing that. Now, we're not going to get there. We're hoping to get there, be carbon neutral by 2050. Most of our healthcare systems have decided, put a date that we're going to do it by 2050. But that's what we're going to, and that's what we're trying to do. Now, it's up to us, all of us as consumers, to put pressure on our healthcare systems to be able to get there. And you do that by making sure that when you sign up for insurance, you sign up for insurance that has decided to become carbon neutral by 2050 and address the emissions that they're producing. So that's one way to do it. So that's one of the things that I think are important to keep in mind in terms of the healthcare system. What are we doing locally? There's a lot of things that our clinics are doing. We're working locally, trying to get away from plastics altogether. Okay? That is a big deal. The amount of plastics that we use in our operating rooms, in our exam rooms, the products that we use and so on, there is so much plastics. I didn't realize how much plastic there was until we started doing a survey on that. So that's what we're working on the local level to try to help reduce the amount of emissions that we do.
Excellent, thank you. Brianna?
Okay, sounds good. I think for this, I'll share a little bit about at Loma Linda University some steps that we've taken and ways that to address the impact of the health system, and also from the student perspective as well. So there's something called the White House Health System Science Pledge that large institutions, health system institutions are signing on to make pledges for their reductions targets for the scope 1, 2, and 3 emissions. And so if you do a search on that, you can find which large universities and health systems have already signed on to that. And I believe that's a goal that we've set at Loma Linda University to be ready to sign on to that. And something that was started in the past year, that was an initiative out of community benefit, which is part of the department that Dr. Belair leads, is a task force for sustainability and an environmental sustainability committee that brings together department stakeholders as well as students at the university and the health system. And we've had quarterly meetings as well as monthly check-ins and different conversations so far to kind of introduce the topic, learn about what resources are available, learn about what's already being done by different departments, and maybe also challenge that and come up with ideas for projects that are attainable, like reducing things like single-use plastics. I think a conversation that I had with one of the physicians in the surgery department at this meeting was talking about scrub caps and buoys, which is one of those things that you kind of have to take a step back and think about, is this really the right thing for patient care and reducing, the thought is that the single-use scrub caps in the OR would reduce infections, but there have been studies that are showing now that reusable scrub caps will have maybe the same rate or even better rate of preventing surgical site infections. And so in speaking with one of the surgeons, she was sharing that this is one of those things where it's kind of a culture that the OR has gotten used to, and it's just part of the system. So it would require a culture change and having those conversations, sharing the data, and then changing the protocols. So there's, as you can imagine, a lot of work cut out for us. But I'm really grateful that these conversations are happening. And as students, we started a chapter of Medical Students for a Sustainable Future. So we have a chapter on our campus. And this past year, we worked on putting together what's called a planetary health report card, where we sat down and we looked at how our curriculum was or was not including climate health topics. So that was really interesting, and I think it really highlighted to us how we would like to introduce those topics. So I think, for example, having lectures on air pollution and local air quality issues during our respiratory physiology blocks would be really cool. And I think I would love to see more of that tie-in to the local level and the issues that are currently at hand into our medical school curriculum. Because a lot of it is very jam-packed, but I think it makes it way more interesting and practical for us to integrate those topics.
So making it more relevant for students in the local context. Great, thank you.
So I'm gonna take us down a slightly different path when we think about our healthcare professionals and our health systems prepared for what we see. So let me take heat as an example. Our emergency rooms are packed. Here in the Inland Empire, we have a healthcare shortage. And so if we think about, and we are also in Riverside County, one of the fastest growing counties in the nation, right? People are moving into the Inland Empire. So if we think about our physician shortage, our emergency rooms are already packed, and younger, we're not well equipped to take on any more emergencies. So if you think about what Dr. Sanchez said about heat and links to respiratory illnesses, cardiovascular illnesses, and now you think about the large influx of people into our county, we're going to have a huge issue in the ability to take care of patients. And I don't mean to scare you all, but I still work in the hospital. I do inpatient rounds. It is really hard, when your emergency rooms are already packed and you have ambulances lined up, and there's not the resources. And if we think about the direction we're heading, it's only going to get worse unless we do something to make it better, right? And so, I think the policies that both Brianna and Dr. Sanchez talked about is really important for us to see how this impacts us downstream by putting those upstream things in place so that we can prevent more and more utilization of emergency rooms as a result of climate. So I just wanted to put that plug in because I think healthcare professionals, when we talk and see patients, there's only so many of us. And if we don't do something different to make our communities healthier and more resilient, we are going to have major issues in the next decade or two. So I know that sounds really doom and gloom, so I promise there'll be like positive things.
It'll get better. It'll get better. I mean, even the concept of cooling centers, we didn't know what that was 5 years ago. Now the counties are putting cooling centers in the summer. If you think of up north, you have snow days, right, where kids don't have to go to school. I remember those days. Here we have smoke days. I remember when we had the big fires on our mountains, the school shut down and food insecurity shot up. What was the relation there? A lot of our kids in our low-income schools get their only food from school. So when the school shut down, that was their source of food. So the lines at the food banks were incredible. So you can see the domino effect of something like forest fires or the increase in fires. We were just talking earlier before the meeting about the fires up north in Canada or the Pacific Northwest and the Great Lakes area and the impact that that's had. They used to laugh at us about our air quality here in Southern California. And then we go visit family up north and it's like, oh, it gets a little worse here right now. You can't even go outside a lot of times. So, and somebody was sharing how a nurse in the Portland area was not able to go to work because her child couldn't go to school. So she had to stay home, and that's one less healthcare provider. So you have to think about all those connections of, it's not just impacting our health, but our workforce as well. So the labor force, when they're not able to go into work, it's like during the pandemic, if somebody got sick and they couldn't come into work, while we have this surge in patients, it's a real issue. Let's transition to my favorite question, and that's question number 3 about lifestyle implications. What can we do as individuals, and this is where the solutions, or we end up on a more positive note. That wasn't thunder, was it? You never know. The clouds were all over this one. What can we do as far as our lifestyles? What are some of the solutions that we can make an impact on this issue of climate change? I don't remember if it was at the ESRI meeting or shortly after, but it was mentioned how people have moved from climate change denial, to a paralysis of saying, oh, now it's too late, we can't do anything. And neither one of those two extremes are helpful because it doesn't have action in it, right? And that's what I love about ANCA. It has the big A for action in it. But Brianna, let's talk about lifestyle.
Sure, happy to. And a thought that crossed my mind is that this is us giving our prescription for climate change and health. So, but
at no cost, with no co-payments.
I'm everyone can make their prescriptions as well with regards to this. So I think, yeah, I'd like to speak first about diet-related changes, and then I'll share more about the transportation piece as well. But I would be remiss if I didn't share about plant-based diets as one of our key solutions for addressing the climate crisis. This is one of those multi-solver solutions when you think about how the intensive water and land use that goes into producing meat and dairy products is, I have some statistics that I'll share, just how much larger it is in compared to plant-based food products. So this was pulled from a study from the NIH that says that transitioning to plant-based diets, which are diets that are rich in fruits, vegetables, grains, legumes, nuts, seeds, and without animal products. So transitioning to plant-based diets can reduce diet-related land use by 76%. And the transition can also reduce diet-related greenhouse gas emissions by 49%, as well as water use by 21%. So these are huge statistics if you think about how much land currently in California and across the West and the country is used for growing things like alfalfa to feed cows, and how much water is put into that land as well. So I think that's one of those things that we can think from a systems level is a challenge to consume more plant-based meals instead of meat-containing meals. And it's not, I'm not asking folks to go vegan overnight, but I think I'm not vegan as well. But thinking more about like flexitarian diets and how you can start cooking more with plants for your health as well. So we know that from nutritional epidemiology studies, including out of Loma Linda, that plant-based diets reduce your risk for things like heart disease and cancer and diabetes. So those who consume more of a plant-based diet have less of a risk, kind of by a quartile percentage. And so, yeah, so if you're thinking about maybe your LDL and your cholesterol, consuming more plant-based diet, more plant-based foods can actually help you with your health as well.
It's back to that one health for the planet and for ourselves, right?
Let's see, and then I think the next lifestyle implication was, going back to the idea of transportation. And so I'd like to share kind of how this all fits into everything. So when we think about our land use and you get in your car and you drive to work or you drive around town, a lot of those land use decisions are made either at the city council level or at the county level. And I remember thinking, why is it that we don't have high quality transit and light rail that goes everywhere, or trains that are fast and reliable that you can take into LA or to LAX or something like that. We do have those trains, but they're slow and underfunded. And so, yeah, I think it's something that I've been learning, that we can't just sit around and hope that things will be different and hope that these larger solutions will come. This is something that we can advocate for. And so the San Bernardino County Transportation Authority is the agency that's tasked with a lot of these decisions. And it's interesting, if you check out their agenda and you kind of see where they allocate their funding, a lot of it goes towards highways and roads, and very little of it goes towards transit. And what little that does go towards transit gets delayed and they don't prioritize projects. And so this is something that me and a few advocates that are friends of mine, we kind of take a look at. And when possible, we go to those meetings and speak in support of specific projects and ask them to change their focus towards public transit over cars and vehicles. So that's kind of a system-wide change that we can see.
So we've got nutrition and transportation. What else, Dr. Sanchez?
Well, I'll jump on that bandwagon anytime, because I've seen the benefits of both of those things, but I'll just give you a quick stat. If we all go plant-based, okay, and we don't use any meat products, you can drive whatever car you want. Okay? Because just getting rid of meat, we can get rid of issues with the emissions, the amount of emissions that come from taking care of our cows, from methane, is so much that it makes any kind of transportation that we have, sort of the emissions from that minuscule. So that's one benefit that we can do. So it's important to do that. Now the benefits, healthcare-wise, are proven over and over and over and over again. I mean, go on Netflix, for those of you that have Netflix or whatever you want, put on Blue Zones and take a look at all the programs that are on the Blue Zones, and that's been repeated over and over and over again. We've known about the benefits of a plant-based diet for a long, long time. We just haven't been able to convince people to do it. And like Brianna said, you don't have to go vegan 100%. Even if you do it 50% of the time, the benefits medically are beyond what you can comprehend. I've taken people off multiple medications for cholesterol, for blood pressure, for diabetes, if they go on a plant-based diet within 3 months. So I've been able to do that in a clinical part. So we have to be able to do that. We have to convince people to start to do that, because that's going to be very important. In terms of transportation, we need to change our focus. I lived in the East Coast, I lived in the Midwest, where I had a car, and I probably, in 7 years living in Chicago, I put 7,000 miles in my car. 7,000. Because I use public transportation to get everywhere. The only time I use a car is when I went outside the city. When I got here, the first year here in California, within 6 months, I put 20,000 miles in my car. Okay? So we have to do a better job. We're not thinking about the way we should be thinking about transportation, the way other folks are doing it, and we have to change that, because it's incredibly important. And then in the policy aspect that we're doing, thanks to our CEO from the California Medical Association, Allison, and her staff here, Janice, we've been able to put together this series on diet and the importance of going into a plant-based diet. And we'll share it with ANCA, so she can share it with all of you, so you can actually start thinking about how to do a plant-based diet, or how to approach a plant-based diet. It's a webinar, 6 talks from health professionals that are going to show you and tell you exactly what you need to do on every aspect of your diet. So that's what we're doing, that's what we want to make, and we want to help you go to a plant-based diet.
And where can people find out more about it?
So we'll share this with you. I'll send it to Linda, so she can share it with all of you. Hopefully she'll put it on her website. You can also go to our website on San Bernardino County Medical Society.
Just sbcms.org. sbcms.org.
And look at events, and it'll have the events listed there. So I hope you can join us, because the person putting this together, we helped her put this together. She's a fabulous doctor from San Diego who's really driving this plant-based diet, not just for one community, but for all of us.
For everyone. Excellent. Thank you so much. Dr. Sen, you want to close off this third question, and then we'll transition into some questions.
Yes, and I know it's getting a little bit late, so thanks for hanging in there with us. So how many of you have heard of Blue Zones? If you don't mind raising your hands. Okay, wow. Did you know we live right next door to a Blue Zones here? Yeah, Melinda, right? And I know Dr. Sanchez had mentioned the Netflix series, so if you haven't seen it, you know, I don't work for Blue Zones, so I'm not trying to promote. In Riverside County, you know, I roll, one of my roles is as our Deputy Public Health Officer. We're actually looking to bring Blue Zones into 5 communities in Riverside County. And why are we doing that? It's because we're trying to impact policy, which we've talked about, policy to increase walkability in our communities, and think about transportation, but to really build that longevity of climate sustainability, utilizing essentially a process that has been shown to work over and over again, as Dr. Sanchez mentioned. Singapore is a reverse engineered blue zones. And that's because of the way they've implemented policies to allow for healthy living to be essentially part of your everyday life, not something you have to drive to a gym to do. But rather you go outside, you walk, right? It's lifestyle. So it's walkability. It's thinking about, you know, all the pieces around, you know, plant slant diet. You know, my husband is loves his steak, right? And so, you know, I'm like, okay, let's think about less, right? Right. Like, how do we make some personal choices to make big impacts? So as we think about, you know, what can we do, you know, as we think about in Riverside County, we're trying to bring blue zones, and we're trying to create a halo effect by bringing blue zones. It's looking at people. What do we do every day? Places. Where do we live? How do we impact at city council meetings? How we advocate for our communities. There's large builders coming in trying to build tract homes that go against building walkable communities. So, you know, it could be profitable if you think about creating kind of that sustainability. It is profitable, but we have to advocate for that. So, you know, I think one of the big things is as we think about what's been discussed up here, please help us think about what you can do too. You know, what are some advocacy things that you can do tomorrow, the next day in your own communities to help all of us so that we can continue to care for you. So,
and it's no longer a secret because it's the Netflix series actually addresses, you know, the secrets of the blue zones. They're all out there for you to imitate, replicate, and expand. Yes.
If you are interested, you can just Google Riverside County blue zones, and you can see all those. It's called the Power 9. You know, the Power 9 is really powerful because it's so simple. It's not like a complex algorithm you have to follow. So if you go to Riverside County blue zones, you can see a lot of those concepts there.
Wonderful. And thank you. I'm so glad you mentioned that because it's a great way to end this discussion. Before we go into Q&A, I'd love to hear from each one of you one action item that you would like to promote, and that's like 30 seconds. One thing that you would like to choose that would make the biggest impact on our climate.
So I wrote like all these things down, right? Like, oh gosh. I think the biggest thing is volunteer. If you can just volunteer. When you volunteer, you hear and see things that we don't think about, right? And so, you know, volunteering will will create resilience in your community, which will impact, believe it or not, climate policy. So, you know, I think about how you spend your time, and if you can spend a little bit of that time volunteering, whether you volunteer to advocate for climate change, whether you volunteer to build community resiliency by connecting with your neighbors, think about volunteering.
And it's a good prescription to one of the biggest public health problems, which is social isolation, right? How about you, Dr. Sanchez?
Well, I also had a list.
As an
of things.
essentialist, the one thing out of your list.
So, since I've been involved in policy for the last 10 years, I think the biggest impact you can do is vote. And vote, not because of your party or who you like or who looks prettier, who looks stronger, whatever. Really look to see who's really has an emphasis on climate change and who really has a real policy on climate change, whether it's at the local level, even the school board, okay, at the state level, at the federal level, that is, I think, the biggest thing that you can do, because that's gonna be in the long term, the biggest impact.
Excellent.
Policy is implemented when we have a problem, but we have to have a solution. We have to have a crisis. We have to have the political will. We need to have the funding, and we have the vision. And I can tell you that we have all of them except one, and that is the political will. So we need to make sure we elect people who have that political will to make the change.
Excellent. Brianna, we've got volunteering and voting. You have to come up with a big. So work that in next. Now, what's your number?
So my challenge for you all would be to find an opportunity, maybe within the next week, where you can replace a car trip with walking, biking, or taking the bus. And that allows you to experience your city and your neighborhood in a different light, and to see some of the transportation and traffic challenges that people face when they're on foot, on the streets, walking around. And so, yeah, if you could do that, and then, maybe it'll be a snowball effect, and you'll find that you can walk a lot more places than you thought you could, or you can bike more places because you found safe trails to do so. So that's our challenge.
And that has to be an active transportation.
I was gonna say, vehicle choice.
Vehicle choice, love it. Okay, the 3 Vs. Thank you very much. You've been wonderful panelists. Well, let's just open this up for a Q&A. Let's hear from our audience. What questions or comments do you all have? Yes.
So working towards becoming a flexitarian, I see a lot of food on the shelf at stores, plant-based, but when I look on the back, I still see things I don't recognize. Are there different ingredients that might be still helpful, or?
So add one thing to plant-based, whole food,
Right.
plant-based.
Stick to the whole food.
That's where you want to go. Yeah, because you're right, there's a lot of vegan stuff out there that,
It's just something.
yeah.
Yeah, one of the frameworks that you can think about is when you walk into your supermarket to shop on the outside of the perimeter, more so than the inside. And so that's where the whole food, the unprocessed foods are located.
That's where the cheese is too.
Yeah.
But no, you're right. I didn't want to spoil Brianna's comment, but yeah, stay on the periphery, and also just buy stuff that doesn't have an ingredients tag on it, like bananas. What's in it.
Yeah, I was gonna comment, except for sprouts, they have everything in the middle. I think what I tell my patients is pick things that naturally occur, so if it's in a box, it's probably not naturally occurring. And the less ingredients, the better. So, if it grows from the ground, it's probably your best bet for a healthy choice. And so, anything growing from the ground, anything naturally occurring tends to be probably what you can aim for. So those are the 2 big things.
And one of the secrets of the blue zones is people growing their own food too. Okinawa, Sardinia, that was one of the common themes.
And I would just add, Costco is one of my favorite stores, but I've decided not to go there as much because all the packaging, I buy things that I'm not going to use for a month, okay? So I've committed myself to making sure that whatever I'm going to eat today, I'm going to try to just have that for that day. And my wife is actually doing a good job of helping me with that, because she's not buying anything that we can store anymore. We're actually just trying to buy things that we're going to cook that day or the next day.
That's where the corner store idea is so good, just buying stuff every day.
Yeah, I think it's in Europe, Asia, other places, like you're shopping daily. First of all, I work a lot, so I'm, probably very guilty of stocking stuff. But thinking about when you stock stuff that is still naturally occurring too. So, I think we have a lot of, I call it first world problems, right? Where we have a lot of excess, and how do we simplify our life in that way?
Any other questions? Let's see.
We have heard about the influx in population with hospitals being overloaded. We've heard about the numbers for the, how you could be benefited by taking public transportation, and with a change in food diet, my opinion, I hope this doesn't offend anybody, what are the numbers? Has anybody done a study on the benefits, of vasectomies?
Vasectomy.
Vasectomy.
Can I comment on that? Actually, that's really interesting because we actually have a declining birth rate, even in the United States. And so, if we think about that declining birth rate, it actually has also impacts to us, right? So, if we have a declining birth rate, your workforce is decreased, and your support for, social support systems like Medicare and Social Security will also be impacted. So, I think it's really interesting because I think a lot of our young people are delaying childbirth, and we're also seeing some countries where they're at negative birth rates. And so, we may, but we're seeing that there is also kind of an imbalance that can cause too. So I think that's actually a really interesting question, and I think we still are trying to figure that out in terms of population and stability of populations. I'm sure you know other panelists.
Well, when we look at populations, those countries that have a negative population growth, it's difficult to see if there's any significant impact on climate change because of that, okay? Let's take China, for example, where they're one child, and they did that for a number of years. They're still one of the biggest polluters in the world, okay? When you look at India, their population continues to grow significantly, and again, the climate change, the pollution that they're producing is so significant. In the U.S., our population is less, but we consume more. So when it comes to our pollution, we make a bigger impact on pollution than any of those countries, no matter how much they blame for their pollution. But we're actually more responsible for it. And our birth rate, for the most part, is decreasing. So it's hard to really pinpoint whether that's an issue or not. I think it has to do more with our consumption.
That's a really good point. And we focus a lot on recycling, but that's the third R, right? What's the first one? Reduce. Yeah, first let's reduce, so we can just start with that. And then second is reuse. And then last is recycle. Let's take a question. And refuse.
Like when you're at the restaurant, don't take those.
Yeah, don't take the straws. Yeah. Yes.
I have several questions right is the AQMD has been working with lots of local agencies, county and cities, to try to improve the air quality for the last several decades. Now I wonder, locally we have health concern because of global change. Have you been working with the AQMD that recently you try to work together to make their program more efficient? Okay, second question is that talking about transportation. Okay, the government has been passed the bill saying by 2035. So all the car dealers have to sell electric cars. Do you think there will be a good impact for the environment relating to come to the climate change?
I love that question,
Let's
actually.
start with the EV question.
Yeah, thank you for that question, because this is actually a point that I wanted to include at some point, but with time, so thank you for bringing this up. So I think the goal for electric vehicles is an interesting one because it requires the production and purchase of new cars and also maintenance of our existing road infrastructure as it currently is. Electric vehicles are part of the solution, but they are not the entire solution to our transportation needs. And the reasons that I can list for that would be, traffic and congestion would continue to be an issue with everyone who changes to electric vehicles. And then when it comes to pollution, we are learning that electric vehicles actually do generate more higher particle dust than gas-powered vehicles. The reason for that being that electric vehicles are heavier, and so the brake dust when they brake, as well as when they drive, is actually one of the largest sources of plastic pollution in the ocean. So we have to think about how all these things are connected. And there's some studies out of the state of Washington showing how salmon populations have been decimated by a certain compound of plastic that's only found in car tires. And so these are things that we do want to be thinking about. And so the shift or the attention paid with regards to subsidies and funding for electric vehicles, personally as a transportation advocate, I feel that a good portion of that should be shifted towards bicycle subsidies, e-bike subsidies, which are much lighter, which get people around in just the same way, as well as transportation funding.
Excellent.
Yeah, and I actually was invited to speak at a transportation conference last year, sponsored by the state. It was some folks. And I can tell you that we all applaud the governor for moving us in that direction. The reality is that we don't have the infrastructure available to be able to support that agenda of having hybrids and electric vehicles by 2035. We just don't, okay? And so we need to look at it a different way, okay? And also, by some of these subsidies that we're using, we have to utilize them in different ways to be able to make it worthwhile for everyone, okay? We have to encourage our minority communities, our multi-generational communities, households, to be able to get into these types of vehicles, but we need to make sure that the infrastructure is there so for them to be able to charge 4 or 5 vehicles that they may have. It's not just easy for us to say, okay, everybody has to have an electric vehicle if you can't find any way to charge it.
If you live in an apartment.
Right, and we also need to make sure we make the price come down. Any of you who have an electric vehicle, you've seen your charging rates slowly creeping up. And now there's a study that shows that the amount you pay for your charging your vehicle at a Tesla superstation may be just as much as you paid for gas. So again, I'm all for them. I have one myself, but we need to make sure we make it properly. We make sure that all the infrastructure is there so we can all benefit from it.
Dr. Singh, did you want to answer the AQMD
I
question?
was.
Okay,
How
perfect.
did you know?
Yeah.
I wanted to address when we think about the air resource boards and things like that, Riverside County attracted the California Air Resource Board to Riverside County for a reason. We wanted them to come to help us because we are the logistics, probably one of the logistics capitals with a lot of air particulate issues. And so, the CARB, when they came in, their whole mission was to try to be carbon neutral. And they've done a lot to help us within Riverside County and then the city of Riverside think about how we think about climate and climate impact. So just wanted to highlight, yes, there are a lot of important partners that we, on the government side, need to partner with to make sure that we can create sustainability in the things that we do.
I want to thank all three panelists. You've given us a lot to think about, a lot to act on, and thank you, Linda and ANCA, for this opportunity. I know this is probably just the beginning of this conversation. And we're going to stick around a few minutes afterwards, too, if those of you have other questions as well. But thank you. Back to you.
Well, thank you all so much. When I had the idea to have this kind of topic here, I never dreamed that we could get people like you guys to come. I'm just so grateful that you did. It was wonderful. Before we let you get up and maybe talk further with them, I just have a couple questions for you. What is one new idea or understanding that you're taking away tonight? You can hear me without a mic, right?
Yeah.
Yes.
More plant-based.
Eat more plant-based, yes. What's another one? A new idea or understanding? Anybody? In the back?
Ride more e-bikes,
Eat.
different
Right, so walk.
transportation. Just don't drive so much if you don't have to.
Yeah. Okay. Eve, did you have one?
Oh, I was just going to say that it's a nice thing to know that the medical community is aware of things and that they're making an effort to,
Yeah, isn't that great?
to solve
know
some of the
that-
problems.
Yeah, I learned a lot about that today. Oh, I got a whole bunch of hands there. 1, 2, 3, real quick.
Minimize the use of plastic.
Minimize plastic, yes, okay, yes.
Promote smart planning, which is, that means is
Yeah.
encourage work at home more, and then also the mixed use.
Oh,
To
yeah.
have industry or retail and residence together rather than just a single family or residential planning
Right.
or the retail sale and all in separate locations, which is you will have to drive every time
So
you
you know, the whole community is designed. okay,
Yeah, right, more centralized.
Yeah, yeah,
More-
thank you. Jen?
No more warehouses.
Anthony?
I think with what Brianna said, was it One Health, trying to look at things more holistically with soil, plants, and our diet and everything with this?
Yeah, that whole concept of One Health, very helpful, right? Okay, one more, Bobby Joe.
Growing our own food.
Growing our own food,
Yeah.
here, all right. So this is sort of a similar question, but what action challenge would you like to take that was offered tonight? And that last round, what challenge that they gave? What are you gonna think about actually doing? Anybody?
Difficult to try the public transport.
Okay, we tried public transport.
Yeah, I tried.
We tried, okay. Well,
4 hours, go to Los Angeles.
yeah, there is that. So what's what you're actually gonna do, the challenge? Maxine? Walk to a local business, okay. Anybody else got one? Anthony?
I'm gonna try to take public transportation to work.
Okay, taking public transportation to work, that's a huge one. Yeah, all right. So, just a couple things before we wrap up. Tonight is our last program here at the Community Center until September, when we'll start these monthly events again. Hopefully, there will still be, in fact, I keep thinking there's going to be growing interest because climate change is accelerating people, So I hope, you can start talking about around your friends how important this is to get this kind of knowledge and information that will help us a lot in the future. So what we're moving into now is our little mini film festival for the summer. We have 2 films coming up, and the first one is Common Ground. Has anybody seen that yet? It's a wonderful movie. It's gotten tons of awards, and it's all about agriculture and how regenerating the soil is one of the keys to our future. So I hope you will put June 20th on your calendar. Join us at the university. There's this cute little intimate theater there and a beautiful patio outside that we all gather and discuss the movie after we view it together. And then the second one is going to be one of my favorite movies, Don't Look Up. Anybody see that movie?
Yeah.
Okay, well, it's interesting. I think you have to, when you see a movie like that, talk with it with a group of friends afterwards. So if you haven't had that experience, even though you've seen it, come in July for that movie. And then some of you have been asking us how to donate to ANCA. We have a QR code on the table there that you can use, and there's a little box there, you can just put some cash in. But ANCA is growing, as you know. We're expanding into new areas that we're really excited to talk to you about, but not tonight. But we do need financial support, so if you can and would like to donate, we would appreciate that. And as somebody mentioned here, volunteering, we do need volunteers. So if you are looking, you have a little extra time, looking where you can put that time, please let us know. And then finally, there's an evaluation sheet on your chairs or nearby, if you don't have one on your chair. If you would take just 2 minutes right now to fill that out, we have pencils. If you need it, raise your hand, and then we'll have something like those. And we just really would value your assessment of this program. We'll be very soon planning for next fall and 2025. And your thoughts about this program are very, very important to us.
Linda, one thing, I want to promote the book that the city bought for us that we're giving out. If you want to walk away with this book, it's a free book, The Climate Diet, 50 Simple Ways to Trim Your Carbon Footprint, very easy to read. Please take a copy for it. And it's some of the ideas, it's not all diet and it's political. It's all kinds of different things that you can do. So it's free. Walk out with one of these if you don't have it. Thank you.
Also, I think it's important to note how successful Earth Day was this year.
Yes, thank you. I meant to mention that when I started. I don't know if you saw the little video that was playing as you arrived. Those were images of Earth Day. And we had our second annual Earth Day. And from all accounts, it was very successful. We had 30 projects demonstrating more sustainable ways to live. And then we had a celebration with lots of information tables and wonderful things that we could learn. So
And the repair cafe was.
and a repair cafe. Anybody go to the repair cafe? Yeah. Okay. Yeah. That's the concept of rather than throwing something away, we see if it can be repaired. And by golly, we found a lot of things that day that could be repaired. I think we had over 30 items that were brought in and got repaired. So thank you for participating in that.
We plan to have another one before next Thursday, so we'll look out for that.
Yeah. Okay, yes. Again, thank you for coming.